Hello, this is Jake MD, and today I'd like to talk about pain management techniques for labor. And this is a somewhat controversial topic, even though it really shouldn't be. There's been a big push towards natural labor with no pain medication type things, and I think that that's drowned out the overall message of what the options are and why they can be useful for any given person. I find that on at least the labor and delivery ward that I work at, that a lot of people, probably over half, want to try doing labor without any pain medication, which is fine, but most of them end up changing their minds. So I'd like to just kind of give you the risk benefits and talk about why it could be nice to have some pain management for labor. And I want to bring up a story and just to kind of get the medical point of view and why I think that getting labor analgesia or labor pain relief is a good idea. And that brings us to a patient comes into the emergency room, has severe flank pain, pain in their back, and they get diagnosed by the ER doctor that they have a kidney stone. And I've never heard of somebody in that situation finds out they have a kidney stone that said, I want to deliver this kidney stone naturally. I don't want any pain medicine. I don't want to have any external influence on this kidney stone. I want it to pass naturally. I don't want any help. And people equate kidney stone pain very similarly to labor pain being more intense in general. And it would be silly for somebody with a kidney stone to say, hey, I don't want any pain medicine. But I hear that very frequently for labor. So that's just from my personal perspective why I think it's kind of silly. But that being said, people are very worried about their baby and don't want to do anything that could risk the health of that baby. So I think that that's where some of this and some of these ideas come from. Second thing I want to say right off the bat is that I have no financial interest in this topic. I do not get paid any more or less if I do epidurals, administer nitrous, or PCAs. I've done all these techniques at one time or another, and it doesn't matter to me at all. I will admit that I like doing labor epidurals, mostly because it's a very satisfying procedure. You can have someone who's extremely uncomfortable, unable to sit still, having a ton of pain during contractions, and within 15 minutes they're able to take a nap if they'd like. And that is incredibly satisfying to me as a physician that I can take that pain away so quickly and completely and allow someone to get some sleep. So that being said, let's get going. Um, First, for different types of labor analgesia, you have meditation, controlled breathing. This can be with a doula or on your own. And those are things that a lot of people try to do and is quite effective by itself or with in conjunction with some of these other techniques, and it has its place. PCA, either by Remmi Fentanyl or hydromorphone, we'll talk more about that. Nitrous oxide, which isn't offered in a lot of institutions anymore, but we'll talk about it. And then labor epidurals. So meditation, basically you are not controlling the pain by any other means than by your mind, and you're able to use deep breathing and able to function through the pain. So it's more of learning how to cope with the contractions and labor than it is to mitigate the pain itself. And this is a good technique for everyday life and helps people manage acute pain of any kind, whether they have a broken arm or if they are going through labor. And I think that it's a wonderful technique, and it really helps people cope with stressors in their life from a pain standpoint as well as emotional standpoint. So I have nothing against this, and I think that it's good by itself or in conjunction, usually with another type of analgesia. Um, Under side effects for this, people oftentimes when they get close to delivering, this is not quite enough and they need some supplementation, or if it's a prolonged labor, um, it's hard to keep focused and do well for that long when you're being awake for 24 hours or so for trying to focus and mitigate pain this way. And you can just be too exhausted to actually push the baby out at the end to actually deliver after you're dilated. And I'm not saying that that happens all the time, but that's a risk. Also, it's a stressful experience, and your catecholamine levels and stress hormones are all elevated, and those stress hormones also can transfer to babies. So we think of it as the most benign or not really having any downside, but if you feel stressed and are in pain, those hormones that are circulating through your body also go to the baby. So it's something that um, most people don't think about, and everything we do or don't do has side effects. So that's why I want to bring it up. Next thing I wanted to do is bring up PCAs, and that's patient-controlled analgesia, and you see them very infrequently with labor analgesia. Now, the PCEA, or the button you push which gives you medicine through an epidural, is very different, and that's used very commonly. So we'll talk about this first. Using hydromorphone, it's a medium range acting IV pain medicine, and this is given through an IV where you push a button and you get an IV medicine. If you want to learn more about PCAs, I have a separate video for that. But hydromorphone PCAs are basically only used for termination of pregnancies, and that is because that pain medicine reaches the baby and can cause bradycardia, can cause when they're after the baby's delivered that they won't breathe on their own. They have to get special medications like Narcan in order to help them breathe. They have to be monitored in the NICU, and it is something that we don't like to deal with, and we don't like administering medicines to the baby if it's not needed or helpful. So that's why if a baby is non-viable, it has to be delivered, or is died intrauterine, and the woman wants to go through labor to get the baby out, or that's generally how it has to be, and just doesn't want to feel anything. It's a very somber, very sad experience that unfortunately I have to deal with on a not infrequent basis. But side effects of any opiates can cause itching, respiratory depression, which is just you're not breathing as quickly and can have problems with your oxygenation or ventilation. And then nausea is another big side effect of opiate pain medicines. So Remmi Fentanyl PCA is another one that is not offered everywhere. It's offered at some institutions and not others. And it's a little controversial about using it. In most places, it's only used if there's a reason why you can't get an epidural, and that can be from bleeding disorders, had extensive back surgery, or have a lot of lower back pain that has components that we're worried about either bleeding or infection, or that we don't think that epidural worked very well because of some factor related to your back, like you have spinal cord issues down in your lower spine. They're pretty technical, and you would know that if you had it, so I won't go into detail about that. Remmi Fentanyl is unique because it is extremely short acting. It lasts only about 8 minutes in your body, and the effect that you notice when you use it is even less than that, usually just 2 or 3 minutes. And it doesn't build up in your system over time, which is why we can use it for viable fetus, or if you're actually undergoing labor and planning to have delivery of a baby, because if it goes away in 8 minutes, that baby shortly after they're delivered can be free of that medication, and it's completely gone, and you have to worry about them not breathing as well or having trouble maintaining their oxygen levels as much with this medication. That being said, the dosing of it's difficult because the dosing tends to need to goes up over time, and you have to time the push of the button very carefully so that when you first start to feel a contraction, you want to already have pushed the button because it takes a good minute before you're really noticing the effects of the pain medicine reaching you. So you want to time the peak of your contraction to be when you have the peak of the medicine effect, which is something that takes people quite a while to get used to, and it takes several contractions over a period of time to get that correct. And some people, it's really hard, even with some practice, to get it to work optimally. And then you have to worry about oxygen levels, and you have to be on pretty strict monitoring, and maybe need some oxygen to try to help keep you as safe as possible and baby as safe as possible while using this. Nitrous oxide is also a medication that we don't use as much anymore, but is still an option at my institution, as are the other things I discussed. And basically, you have a face mask like for surgery that you hold yourself over your face, and you take deep breaths, and it has a closed system so it doesn't put nitrous into the room if you're not using the mask. But when you breathe into it, it delivers that nitrous oxide to you, which is kind of the laughing gas that you've heard about, or might use with the dentist. Side effects is that it stops working or works far less effectively after a pretty short period of time. So it's good if you're like at the pushing stage and you don't want an epidural or haven't had one, and you're going to be in labor for a very short amount of time yet, and just need something to kind of help get you through that last little bit. That being said, I've only seen it work well about a third of the time. Some people do really well with it and could take the breaths. This has to be dosed ahead of time, just like that Remmi Fentanyl that we talked about. And yeah, it can give you a headache or give you some nausea, which are side effects I didn't mention, but are definitely present. And then it's hard to, when you're pushing, you're focusing on like holding on, and it's hard to hold a mask to your face to breathe that in while that's happening. So it's challenging to use well, um, but is an option, and some people find it very useful. Other things that a lot of people mention is that it's a potent greenhouse gas, which I don't think is a reason not to use it. I think that if you're extremely environmentally conscious, that's something you can think about. But in the grand scheme of things, we're not using a lot of nitrous for a short period of time, that if it's going to allow you to have your baby more comfortably, that I think that's a fine thing to do. Also, just to briefly mention for completeness, is that there has been some data, anecdotal, not good studies, because it's not ethical to do studies that show that nitrous exposure in the first trimester of pregnancy can lead to, possibly lead to increased loss of the fetus or miscarriage. And that data has been basically shown from women working in dental offices that use a lot of nitrous, and it's not good data by any means. It's not a proven effect, and as you can tell, you can't expose pregnant women to nitrous, because that would be extremely unethical, because if you did cause any damage or harm, that would be hard to live with and wouldn't be something we'd want anyone to deal with. So that's data that we'll probably never know, or never know well, just because it's not ethical to do a study to look at that. Finally, I'd like to talk about basically the bread and butter, what most people get for labor analgesia, and it's because it's the most effective, and it's called an epidural. And an epidural is where you put a catheter in your back, and that catheter can deliver pain medicine and numbing medicine all the time to give you a pretty complete relief if it's working well of any sharp pain that you feel during labor. And they tend to be pretty effective. Sometimes they have to be manipulated, either the catheter moved a little bit because it's working on one side or not the other, or replaced because it's not working well at all for whatever reason. This catheter is placed by feel, so people who do a lot of them tend to be better at it than people who do less. And it's something that you kind of get a feel for over time, and most time you can tell when you're in the right spot pretty easily, and then that medicine can give pretty good relief. Usually it starts in about 10 to 15 minutes. You'll feel a big difference. And we use pretty dilute solutions of the local anesthetic as well as pain medicine for the labor epidurals, just because we want the woman to still feel the contractions and still be able to push to help baby come out. And do this is not to ruin the experience, as what a lot of people looking for natural births worry about. So that's to kind of give a nod towards that. That being said, every institution has their own way of doing the different concentrations of pain medicine and numbing medicine, so I can't speak to the one that you're going to be going to, but at our institution we use pretty dilute solution. Things to think about is if you did have to have a C-section, we can give much stronger medicine through it to allow you to have that C-section with just that epidural, and you wouldn't need to have an extra procedure to have that done. So you can think of that as an advantage, as if something, baby stopped wanting to come out or had a prolonged decel, that we'd be able to get to the OR and use that epidural to do the C-section to save baby. Most of the time. Once in a while it doesn't work quite well enough to do that, but we always check to make sure that you'd have adequate pain relief before starting a C-section, and then we could do something else if that wasn't working. Also, I want to mention that very low levels of that numbing medicine do go to your bloodstream. We deliver it to your back, so it gets absorbed through the blood vessels there. Hasn't been shown to cause any harmful effects to baby. There's also some pain medicine that helps densen that block to help control that sharp pain as well. And then that doesn't always, or can go to baby as well, but they're very low levels and usually don't cause any problems to baby at all. Side effects of epidurals. The biggest one that I like to mention to people is called a post-dural puncture headache. And I might make a separate video about that, but in short, basically when you place an epidural, there's risk that you can have some of the fluid that surrounds your spine leak out into that epidural space, and that can cause a headache. And it's a positional headache. It means that when you lay down you don't have it, and when you sit up you have a pretty severe headache, and that usually comes 48 hours after you've had an epidural, and it happens about 1 in 100 approximately epidurals placed. Usually they're self-limiting, but sometimes they have to be treated with what's called a blood patch, and I can discuss that in another video. It becomes more technical and isn't really right for this talk. Other side effects, epidurals can decrease your blood pressure, mainly because all that pain and stimulus that you're feeling that clamps down your blood vessels, and those all relax when the pain goes away. So that's part of it, as well as the epidural itself can dilate some of the blood vessels around the area that's has the numbness. So your blood pressure can be a little down. We check it frequently, give you some fluid through your IV to help mitigate those things. And usually it's not a problem that we worry about too much. Anytime you break the skin, there's risk of infection or bleeding. That bleeding is usually like nothing to worry about. Once in a while it can be back in the epidural space, which can be a significant problem, but that's a very rare complication. nothing that happens, or nothing that I've seen from a complication of a labor epidural. And most people haven't seen it in their career. It's a very rare phenomenon. Infections are also very rare. We use sterile prep and drapes and masks to limit that effect as much as possible. And then itching or nausea, that's mostly due to the pain medicine we give in. It's very low doses, but when you deliver it directly into your back, that sometimes can have a little bit more response than you'd have normally. Like if you gave that medicine IV, just because it's going directly to your nerves and your central nervous system. And I think that covers labor pain management very briefly, very broad overview. Um, I can make more specific videos about subsets of this information because it's just too long of a talk to do all at once. If you have any questions, concerns, comments, message me or leave a comment and I can further clarify things. And otherwise, like, comment, subscribe, and thank you very much, and thanks for listening.